How COVID 19 spreads. What is the source of the virus? COVID 19 is caused by a coronavirus called SARS CoV 2. Coronaviruses are a large family of viruses that are common in people and many different species of animals, including camels, cattle, cats, and bats. Rarely, animal coronaviruses can infect people and then spread between people. This occurred with MERS-CoV and SARS-CoV and now with the virus that causes COVID 19. The SARS-CoV-2 virus is a beta coronavirus like MERS-CoV and SARS-CoV. All three of these viruses have their origins in bats. The sequences from US patients are similar to the one that China initially posted, suggesting a likely single recent emergence of this virus from an animal reservoir. However, the exact source of this virus is unknown. How does the virus spread? The virus that causes COVID 19 is thought to spread mainly from person to person, mainly through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Spread is more likely when people are in close contact with one another. COVID 19 seems to be spreading easily and sustainably in the community in many affected geographic areas. Community spread means people have been infected with the virus in an area, including some who are not sure how or where they became infected. Why are we seeing a rise in cases? The number of cases of COVID 19 is rising due to increased laboratory testing and reporting across the country. The growing number of cases in part reflects the rapid spread of COVID 19 experience community spread. More detailed and accurate data will allow us to better understand and track the size and scope of the outbreak and strengthen prevention and response efforts. Can someone who has COVID 19 spread the illness to others? The virus that causes COVID 19 is spreading from person to person. People are thought to be most contagious when they are symptomatic. That is why he recommends that these patients be isolated either in the hospital or at home until they are better and no longer pose a risk of infecting others. More recently, the virus has also been detected in asymptomatic persons. How long someone is actively sick can vary, so do the decision on when to release someone from isolation is made using a test based or non test based strategy in consultation with state and local public health officials. The decision involves considering the specifics of each situation, including disease severity, illness signs and symptoms, and the results of laboratory testing for that patient. Learn more about when to release someone from isolation and discharge hospitalized patients with COVID 19. For more information on when someone who has been sick with COVID 19 is able to stop home isolation, see interim guidance for discontinuation of in home isolation for patients with COVID 19. Someone who has been released from isolation is not considered to pose a risk of infection to others. Can someone who has been quarantined for COVID 19 spread the illness to others? Quarantine means separating a person or group of people who have been exposed to a contagious disease but have not developed illness from others who have not been exposed in order to prevent the possible spread of that disease. Quarantine is usually established for the incubation period of the communicable disease, which is the span of time during which people have developed illness after exposure. For COVID 19, the period of quarantine is 14 days from the last date of exposure because the incubation period for this virus is 2 to 14 days. Someone who has been released from COVID 19 quarantine is not considered a risk for spreading the virus to others because they have not developed illness during the incubation period. Can the virus that causes COVID 19 be spread through food, including restaurant takeout, refrigerated or frozen packed food? Coronaviruses are generally thought to be spread from person to person through respiratory droplets. Currently, there is no evidence to support transmission of COVID 19 associated with food. Before preparing or eating food, it is important to always wash your hands with soap and water for at least 20 seconds for general food safety. Throughout the day, use a tissue to cover your coughing or sneezing and wash your hands after blowing your nose, coughing or sneezing, or going to the bathroom. It may be possible that a person can get COVID 19 by touching a surface or object like a packaging container that has the virus on it and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spreads. In general, because of poor survivability of these coronaviruses on surfaces, there is likely very low risk of spread from food products or packaging. Can I get sick with COVID 19 if it is on food? Based on information about this novel coronavirus thus far, it seems unlikely that COVID 19 can be transmitted through food. Additional investigation is needed. Will warm weather stop the outbreak of COVID 19? It is not yet known whether weather and temperature affect the spread of COVID 19. Some other viruses, like those that cause the common cold and flu, spread more during cold weather months, but that does not mean it's impossible to become sick with these viruses during other months. There is much more to learn about the transmissibility, severity, and other features associated with COVID 19, and investigations are ongoing. What is community spread? Community spread means people have been infected with the virus in an area, including some who are not sure how or where they became infected. What temperature kills the virus that causes COVID 19? Generally, coronaviruses survive for shorter periods at high temperatures and high humidity than in cooler or drier environments. However, we don't have direct data for this virus, nor do we have direct data for a temperature based cutoff for inactivation at this point. The necessary temperature would also be based on the materials of the surface, the environment, etc. Can mosquitoes or ticks spread the virus that causes the COVID 19 illness? The main way that COVID 19 spreads is from person to person.